Hi everyone, I am GK Emmanuel. So today we are going to talk about Captopril, sold under the brand name Captopril. So Captopril is an antihypertensive medication used to treat or manage hypertension. Captopril is an ACE inhibitor, which is angiotensin converting enzyme inhibitor. So ideally what happens in the body is that the kidney releases the renin and then the liver also releases angiotensinogen. So the renin converts the angiotensinogen to angiotensin 1. Whereas the lungs also releases these angiotensin converting enzymes, which are released to convert angiotensin 1 to angiotensin 2. So the angiotensin 2 is responsible for increasing the blood pressure, which we term as hypertension. It uses two different mechanisms to increase the blood pressure. So the first one is it causes vasoconstriction. So it acts on the blood vessels to cause this to constrict so that the peripheral resistance can be increased for the blood pressure to increase. And then the two is that it stimulates the adrenal cortex of the adrenal gland to cause the reabsorption of sodium and water. So when there is reabsorption of sodium and water, it means that there will be water retention in the body, which would equally increase the cardiac output, thus increasing blood pressure. So looking at this explanation, it means that the angiotensin converting enzyme, they are those enzymes which would convert the angiotensin 1 to angiotensin 2 for all these mechanisms to follow to increase the blood pressure. So what we have to do is that we have to give captopril to inhibit the releasing of these angiotensin converting enzyme from the lungs. So basically that is the mechanism of action for the captopril. Now, we did mention that the lungs releases these angiotensin converting enzymes, and once captopril is administered to the patient, it means that the angiotensin converting enzyme won't be released anymore. So the angiotensin converting enzyme, they are going to build up in the lungs, which would manifest itself as cough. Because of that, one side effect or one major side effect of captopril is dry cough. So if a patient is on captopril, the patient is likely to experience dry cough, and it's a side effect of it. You also have to take note that captopril is strictly contraindicated in pregnant women. It's strictly contraindicated in pregnant women. So that is one thing so that you have to take note. Follow me more for videos. Follow me and then like my videos. Make sure that you share and then drop your comment section and then drop anything that you don't really understand. And